your time to grow. Plant the seeds of purpose.
Welcome to the Rip and Rise podcast. Today, we're diving into the world of anxiety disorders. It's really prevalent and something that affects millions of people worldwide. So when we talk about anxiety disorders, what are we really referring to? What is the scope of the problem? So, anxiety disorders aren't just feeling a little stressed before a big presentation. No. We're talking about a group of mental disorders where the primary symptoms is excessive fear or worry, and it's huge. According to the World Health Organization, back in 2019, it affected an estimated 301 million people globally, making it the most common type of mental disorder. And that's a staggering number. And interestingly, women are more likely affected by anxiety disorders than men. And while it can hit anyone at any age, symptoms often show up during childhood or adolescence. And yes, that's young. So if someone is experiencing these symptoms, what kind of treatments are available? Well, the good news is that there are highly effective treatments available. However, and this is a big however, the WHO says only 1 in 4 people who need treatment actually receive it. And that's a huge gap. So then, what are some of the barriers preventing people from getting help? Well, a few things, like lack of awareness is a big one. People often may not realize that they are experiencing a treatable condition. There's also that lack of funding in mental health services, not enough trained health professionals, and also, unfortunately, a lot of social stigma surrounding mental health. So all these things make it difficult for people to access help. So let's talk about the actual experience of having an anxiety disorder. What does it feel like day to day? Well, everyone feels anxious sometimes, and that's normal. But with anxiety disorders, it's different. The fear and worry are much more intense and excessive. And it's not just in your head. So it comes with physical symptoms like the muscle tension, a racing heart, or the fight or flight stuff all kicking in. So it's both mental and physical. It's like a full body experience and can be really debilitating. It can disrupt your daily life, affect your relationships, your work, schooling, everything. And it's not something that you can just snap out of. And speaking of different experiences, what specific anxiety disorders are there? Oh, there's several. So generalized anxiety disorder, or GAD, is when you have persistent, excessive worry about everyday things. And then there's the panic disorder, which involves sudden panic attacks and the fear of having more. And then you've got the social anxiety disorder, a fear of social situations where you might be judged or humiliated. It can feel incredibly isolating. And then there's also agoraphobia, which is a fear of situations where you might find it difficult to escape in case you have a panic attack. Separation anxiety, which isn't just for kids, is excessive worry about being separated from a loved one. So many different types of anxiety can manifest in lots of different ways. And what about phobias? Where do they fit in? So phobias are also anxiety disorders. They can be specific phobias like intense, irrational fears of specific objects or situations, like spiders, heights, or even flying. And then some people can also experience multiple anxiety disorders simultaneously, and symptoms can change over time. Often they start in childhood, like we said, and in adolescence, and continue into adulthood. Again, sadly, girls and women are more likely to experience anxiety disorders than boys and men, but they can also be affected. And what causes these disorders? Anxiety disorders, like mental health conditions, result from a complex mix of social, psychological, and biological factors. Traumatic experiences like abuse, or severe losses can definitely increase the risk. So a combination of factors, not just one single cause. And physical health plays a role as well. Anxiety and its impacts like muscle tension or alcohol use can be a risk factor for other things like cardiovascular disease. And conversely, having a chronic illness can cause anxiety due to the stress of managing that condition. So as you can see, it's all interconnected. And what about prevention? Is there anything that we can do to lower the risk of developing an anxiety disorder? Well, definitely. So when you look at community-based programs, these are key in helping. And examples include parental education, school-based programs, and teaching social and emotional learning can help children develop coping strategies in early childhood. And exercise is also beneficial for adults in preventing anxiety. So early intervention and healthy habits can make a big difference. So now let's say someone is experiencing anxiety. How is that diagnosed and how can it be treated? What options are there? Well, the first step is seeking help. Talk to a doctor or a mental health professional. There are several effective treatments that are available. So psychological interventions like the talking therapies are essential in treating anxiety. And cognitive behavioral therapy, or CBT, is a big one. It helps people learn new ways of thinking and coping with their anxiety triggers. It's also about changing your thought patterns and behaviors, and this can be done individually or in group settings, and now can be accessed online as well. There are also self-help resources available like manuals, websites, and apps. Yeah, so it's quite accessible. And in addition to therapy, stress management techniques like relaxation, mindfulness can all help in reducing the symptoms of anxiety. And then sometimes medication is also needed. And if the healthcare professional says you need medication, it's worth listening and trying it out. Antidepressants have been known to be useful in some adults with anxiety disorders. Again, with medication, it's not one size fits all. Healthcare provider will need to consider the potential side effects and the person's individual needs and what other treatments are available before prescribing anything for them. It's worth mentioning that benzodiazepines used to be commonly prescribed for anxiety, but now they're generally not recommended because they are highly addictive and not effective in the long term. And what other things can people do on their own in addition to the professional treatment? Well, self-care is crucial. And I always say this on my podcast, that self-care is really important. So things like avoiding alcohol and drugs, exercising regularly, sticking to a healthy diet and a sleep schedule, and practicing relaxation techniques and mindfulness can make a big difference in managing symptoms. And taking care of your overall well-being can have a positive impact on anxiety as a whole. The World Health Organization continue to work on improving access to care and resources worldwide. They have developed brief psychological intervention manuals that can be used by non-specialists to deliver therapy to individuals and groups. They also have resources like the Problem Management Plus manual and also the Self-Help Group-Based Stress Management course. And they've also done a self-help book called the Doing What Matters in Times of Stress that teaches skills about reducing anxiety and stress. So there's a lot of work being done to address these issues on both individual and global levels. So to conclude, remember, you are not alone. Anxiety disorders are common and treatable. And if you're struggling, please reach out for help. There are resources available and things can get better. So thank you for tuning in the Reap and Rise podcast. So references and other helpful resources mentioned in this episode can be found in the show notes. And thanks for listening. Remember to share and subscribe so you never miss an episode. And also visit our website and our socials for more resources. Until next week, continue to reap and rise.